Okay. Good evening, sir.
Yeah, good
Good
evening. How
evening.
are you doing?
Yes, so nice to have you here.
Yeah, same here.
Thank you so much. I mean, how you volunteered without even any brief notice or anything. Thank you so much. God bless you, sir.
Yeah, you're welcome. It's my pleasure.
Yeah. All right, so everyone, we are live with Dr. Uchenna. I think it's a miracle Dr. Uchenna is here because before now, due to the level of the requests I was getting and the questions I was getting about this situation and how it affected lots of marriage, I even reached out to a doctor and but he wasn't in the country and he felt it's something that could wait. But then I took it up in prayers and I told God, this is something we needed light, we needed knowledge, we needed clarification. So you just have to make a way. And it was the same day that doctor decided to, he volunteered to be on the session. That I was like, this is just God. So let's sit tight and be ready to ask questions. But please share this on your profile so that people will join, will get to watch the video, get to learn, because a lot of light, a lot of knowledge, a lot of value will be communicated tonight. So the best you can do is right now share this video for someone to be able to join us. All right, let's get to know a little bit of Dr. Uchenna. Let me quickly read this profile. Dr. Uchenna Ugochukwu Zekwe, PTMD, aka Bethany Blaze, is a physiotherapist and second generation physician with over 10 years of combined experience in health advocacy, management, rehabilitation, and education. He has also gained certifications in life coaching, cognitive behavioral therapy, and others still in view. Dr. Uchenna is also a content creator and boasts a portfolio ranging from self-help, personal transformation, self-awareness, and health education. He has acquired extensive volunteer experience both in Nigeria and in the Caribbean. He has been featured in ABS TV, Radio, Purity FM, Oka, Anambra State, Radio Nigeria, Port Harcourt, that's Treasure FM, River State, and WGR Entertainment USA. Due to his inspirational, motivational, relatable, and realistic writing style, Dr. Uchenna has been described as the writer's doctor, the poet smith, the vase maker, and content craftsman. His special interests include personal transformation, gender equality, healthy living, international travel, study abroad, mental health, community healthcare, and well-being. Dr. Ozekwe presently works as a medical officer in Imo State, Nigeria. Please, let's celebrate Doctor. Such a capacity man. It's so nice meeting you, sir. When I read your profile, I was like, wow, this is just God gift to us. Thank you so much for coming. God bless you, sir. All right,
Yeah,
tonight we are talking about erectile dysfunction. And I know a lot of people that will be listening tonight have no medical understanding. I know you want to be tempted to use a lot of medical words, but please, for the sake of the layman, I want you to, as much as possible, break down every word so that everyone will be able to understand and assimilate everything that will be said tonight. So the first question will be, please, what is erectile dysfunction?
Okay. All right. Good evening, everyone, or good day, depending on where you are listening from. Thank you very much, Ms. Janet, for this opportunity. Personally, I think I'm more honored to be here. Yeah. So, in response to the question, first of all, we have to start with what is for erectile function, because it's actually when there is a problem with the function that we have what is called erectile dysfunction.
Okay.
So erectile function is the ability of the male organ of the male or the ability to initiate, initiate, maintain, and achieve sexual satisfaction. Now, there's a lot of components in this. There's a lot of components in erectile function because there are a lot of things that actually made it possible for a man to be able to have an erection and have ejaculation and respond sexually to his wife and to his spouse. So there is actually a whole lot of this. So it's not just one aspect. So there are components to it. Number one, there's a hormonal component, there's a physical component, there's a psychological component, and there is I think hormonal, vascular, and a physical component. Then there's an emotional component. So that's about 5 of them: emotional, hormonal, emotional is taking care of psychological. Then there's a physical component. Now the thing there is erectile dysfunction. Now is the inability, or we can call it difficulty in initiating, maintaining erection for optimal sexual performance. Because it is important for us to have this in mind. If you don't know what is the main thing, it is difficult for you to understand actually where the problem is coming from. So that is what erectile dysfunction is. The inability, because you have to initiate, you have to you have to maintain, and you have to achieve sexual satisfaction. So these are the main points in every definition that has to do with erectile dysfunction.
Okay, so simply the inability for a man to perform and achieve sexual intimacy with his spouse.
Yes.
All right. So please, can you tell us what are the causes of this? What could be the causes?
Okay, like I mentioned before, is when you talk about erectile function, you're talking about the ability to achieve this. So it means that the hormonal component has to be in order, the physical component has to be in order, the emotional component has to be in order, and the neural component has to be in order. Now, when you combine all these things, you will now discover that any problem that arises from erectile dysfunction comes from these areas. You see, when you notice it comes from this area, it's easier for you to know where your solution is coming from. So that's why I had problem with people that, okay, when the man is not able to perform, the next thing they think about is kanyamata, or they start thinking about one other thing. That is the first place they go to. You have not tried to look at the other surrounding issues. Because me personally, in my own practice, I am very, very concerned about the sociological aspects. What is the social aspect? Most times I meet a woman, she'll come, okay, this one, okay, madam, what about your husband? What about this? What about? I always ask those questions. So sometimes it might feel as if I'm being intrusive, but that's the truth, because I know that there is always a social component to a psychological or physiological problem. So that's why when you hear people say, okay, I'm having sugar, I don't just say, oh, well, you know what? Okay, don't worry. I just give you drugs. Just bye-bye. Don't worry. Okay, make sure you take your drugs. Come back, see you in 2 weeks' time. No, you have to look at what the person is feeling about, because all these issues you're looking at, diabetes, hypertension, all of them, there's always a psychological component to it, emotional aspect of it, because it's actually the emotional aspect that helps to worsen the health condition. I see people today when they die of maybe they had a stroke, or they are having hypertension. The things that worsen it or that lead to them dying or something is always the emotional component. Because the sugar one is very easy. Like example, I was giving to them yesterday in a program where I spoke. I told them that one of the most painful things in life is when you're looking at food, you know that you cannot eat this food. Like, doctor said I should not eat this, and yet there is food in the house, but you cannot eat because that is not the food you're supposed to eat. It's one of the most heartbreaking things. If there is no food in the house, you understand, you take water and be happy. God bless you. In fact, you're so happy with your life and you go and sleep. Tomorrow you hustle again. But this one, there is food, but you cannot get that particular one that you're supposed to eat. So that is just the thing. So it's a whole amalgam of different aspects or to look at aspects for you to be able to show, okay, this man is able to perform his job appropriately or do the other room work very well. That is just it.
Okay, sir. So before we talk about the treatment, because I know everybody will be waiting for, let's go straight. How do we treat this? Because there's a lot of people suffering from this. Let's look at are there things a man can do to actually prevent himself from having this dysfunction?
Okay. Yes, there is. You see, the problem is that we live in a society, I'm still going back to the sociology aspect, we live in a society whereby the man is not expected. Okay, we don't expect him to talk, or he doesn't share his own concerns, and this is a problem. While we are here shouting patriarch, patriarch, and say, okay, women and these women are, the issue there, this man is not talking. He's not able to express himself. You have seen situations. Okay, this is what I see most times. You see a man, he will take all this time, bring all his family to the hospital. Okay, the wife, the children, and everything. Oga, come now, let's check you. Don't worry. When you are done, just tell them they will come here for come and pick them. He's serious about it. Oga, can't you come? Maybe just come. Let's just do a urine test. Just let's know how you're doing. Don't worry, I'm fine. I'm fine. Oga is dying inside. Actually, he might be hypertensive, but the next moment he's willing and very, very able to bring his wife, bring his children to the hospital. And you see the woman, just one little pain on her hand, she will come. Meanwhile, the man, for him to come to the hospital, know that maybe that thing has affected his ability to meet his wife. That's when he will come. And I keep on just saying, so you came to the hospital. If not for this, you not come to the hospital problem. So now it's a problem. Now, what do they do? First of all, we have a major problem, which many times even my fellow colleagues don't usually address. They don't address it the way it ought to. We have a general problem now of insulin resistance. Now, what is insulin resistance? Insulin resistance is actually the reason why a lot of all these health conditions you are seeing today, if it's hypertension, if it's diabetes, a lot of them, even some of the neurological one, maybe like stroke or other, all of them are, many of them are as a result of insulin resistance. Now, what is insulin? Insulin resistance is when your body's decreased response to production of insulin. Now, when insulin is produced in the body or from the pancreas, it is expected that it is, it's supposed to help you to to metabolize the sugar and all that for you to be able to use it to generate energy for you to do what you want to do. However, we have a problem whereby the insulin, when your body is not responding appropriately to it, then the body produces more. I thought that the one I gave to you is not enough. It wants to produce more. Now, when it produces more, it leads to a whole, bulk of health conditions. Now, many of these health conditions, for example, number one of the problems with hypertension is insulin resistance. Now, this insulin resistance will now lead to a decrease in, they call it, is a nitrogen oxide. Nitrogen oxide is supposed to help you to have dilate, like expand your muscles. Now, you're supposed to, when you have enough nitrogen oxide, you're supposed to you're not supposed to have issues with breathing, with your blood pressure, even ejaculation, sexual response, and all those things. However, the insulin attacks the endothelial muscles. Now, those muscles are inside any vessel that you have in your body. You're supposed to help it to expand. Now, when this thing is affected, there's a decrease in pressure. It leads to, when it causes a decrease in pressure, it can manifest as hypertension, it can manifest as erectile dysfunction, it can manifest as even high cholesterol. So it's a whole big issue. So a lot of men today, part of the things they should do is to do things that will ensure that they have increased insulin sensitivity. Yeah.
Okay.
I have a lot of friends that have been talking about this. So a lot of them that might be listening to them might be familiar with these things. But then, however, it's important what I mention it because it touches everything that they must have experienced. Insulin sensitivity is when you have trained your body, or your body has trained itself to be able to respond sharply to any more insulin that is produced. Now, you do that by the kind of food you eat, by the kind of things you do, and the kind of your lifestyle. So generally, it's your diet and your lifestyle. If you're able to deal with this, then insulin will not be a problem. Insulin resistance will not be a problem. Then it means that you now have insulin sensitivity, increased insulin sensitivity, for you to be able to deal with some of the health issues that come your way. It also reduces your chance of having to need to take drugs, because many times people, they just feel, okay, drugs are quick fix. Many times they are not the long-term things that you need for you to be able to deal with a health condition. So now for men, what are those things they can do? Number one, to increase insulin resistance, you have to look at your food. What kind of food do you eat? Many men today, they will go in the evening, they go and drink. They take alcohol, they drink, like when they finish, tomorrow they will go again. Next day they'll go again. Before you know it, the person starts having obesity. These are one of the causes: obesity, increased cholesterol, hypertension, diabetes. All those things will combine together to lead to the person having erectile dysfunction. Meanwhile, remember, we have not talked about the emotional component. We have not talked about that part. That part is just on its own. Yes. So now, when you have this, it can also some of the other causes, because why I'm actually talking like this about this is that they are all so much interconnected. You can't easily isolate from the other. So now, for some of the things the men should do is that they have to modify their lifestyle. Part of the thing they should do, many of them that are into alcoholism, they should stop, totally stop. There is no need, because high cholesterol, high carbohydrate diet is already a problem. A lot of them, it's already a problem. Some of them are not even eating well. Like, there's even between eating healthy and eating well. Because you can take diarrhea and fill your stomach. At the end of the day, what can you even say what the food you ate gave to you? You cannot even account for the food that was given to you. Because we just go out there, oh, they sell this, they sell that. These days, you see meat pie. I used to tell them it's something pie. They'll just open the meat pie, put something there, and they say it's meat pie. But I'm actually looking for the meat in the meat pie. So at the end of the day, what you're eating is already causing a problem before we even start talking about whether it's actually the right thing. Then before you now start going things to noodles, all these synthetic foods. So you have to look at the synthetic foods they're taking. Many of them are taking high carbohydrate diet, which is not good, especially for a man that wants to perform his duties very well. Then you now look at people that are drinking a lot. High carbohydrate drinking is also part of it, because one bottle of beer can have enough carbohydrate to cause more problem for you. So you think that it's not bitter. It is not. It means it still has a lot of carbohydrate. Because that's what some people used to deceive themselves. They say, after all, beer is not bitter, it's not sweet. Not knowing that it's actually more. One bottle of Coke, a bottle of beer, you can have almost 3 or 4 bottles of Coke in it. Yet you say because it's not sweet, that it's bitter. So it's a whole lot of things. They should look at their food. Then they should also manage stress. You see, stress is very, yes, at any point in time we experience stress as as human beings, part of our work, the environment, the economy, workplace, home, children, husband, friends, village people, non-village people, neighbors. So there's so much stress around. All you have to start managing stress, because there is stress hormone cortisol. It's actually a problem. Once you have a lot of cortisol in your system, it also predisposes you to a lot of health conditions. You understand? And many people, they think because they are sweating or they are doing things that make them sweat, they think they're exercising. You understand? So I've not even got that. I don't want to go into that, but that one will take us to things you need to do to, improve erectile dysfunction. So now, these are the things. You have to modify your food, manage stress. You have to look at your lifestyle, modify your lifestyle. We live in a culture whereby the men, when the women suggest something to them, madam, keep quiet, but you're not supposed to suggest anything to me. Who are you, self, to even suggest something to me? Don't you know you're not supposed to be talking? Don't you know in this village, these women are not supposed to be talking. If you talk, they will report you to Umuna, So that kind of thing. But it's a problem because it's doing more harm to us than good. It's causing more harm. It's causing more harm. Yes. So that is the thing. Basically, lifestyle. Maybe if as we progress, maybe I can go into more specifics. But dietary modification is very important. Managing stress is very important. Then 2, seeking help. Like when I mentioned the causes of erectile dysfunction, one of the things I talked about was the emotional side, which I said is actually an issue on its own. Why? Because when you know where that problem is coming from, you can know where to channel your energy to. There's a lot of people today, what is worrying them is that, okay, just go and sleep. Just go and sleep. Sleep for 4 hours, 5 hours. That is the solution to the problem. No, they don't want it that way. They want to take paracetamol. They want to take one drug or the other so that they can go and sleep. One of the worst things you can do to your life is for you to be dependent on drugs for you to be able to sleep. Sure. It's a problem. So whatever you do that will make you to achieve optimal health or high quality of health without having to take the drugs, then you have to take that part. Now, for all these things we have talked about now, a lot of people are having problems, adherence, because even the drugs they're taking, many of them are not even adhering to those drugs. So why are we even killing ourselves? So, but then you are not talking the sociological aspect. And like one of the comments somebody made in one of your posts about this presentation, it said that is something that's affecting the men. Women are the ones that are talking more about it. I don't know whether you remember that comment. Yeah. So they're the ones that are championing it. But that's the irony of life.
True.
That's the irony of life. So, but then, you see, I want to urge our women, many of them that are listening, is that if you don't speak, if you don't assert your right on some things, tomorrow it will come back on you. It is better that they report you and say, oh, that you told him to go and take care of his health. You can defend yourself anywhere. History will be kind on you. Then you keep quiet. And tomorrow, when they will say, he has his wife that he married now, that woman will kill him. Now you are now the devil. But at least if you say, tomorrow, even if they report you to the evil of your community, you say, what was your offense? That you told him to take care of his health. That you are concerned that this one, you don't want your husband to die before his time. I'll be there praying for your husband to die before your time. They will not say, sorry, that was not what we meant to. They will not say, you have covered yourself. Yeah. You know, these things are small psychology, but our women always want to fight. It's not about fight. It's about telling them, if people want this man to die before his time, make me a young widow, then you encourage him to be doing what he's doing. By the time you play this card very well, play it in a way that will make him feel guilty, nobody will tell him to go and take care of himself. That's it. Yeah.
Okay, so I had a situation some time ago, last year. This young lady, she was 24. She got married and her husband was 27. And then after the wedding night, sorry to say, they tried to, get engaged in sexual activities and then discovered that the husband was completely dead, impotent. And so she is a medical doctor. She just did her sponsor academica and was planning to go out to UK and all. And so she reached out to a senior medical officer and said, look at what is happening, because the man was not willing to open up. He first of all lied that it is stress, stress from the wedding. Like, how can you be tired than the woman for the wedding? So he said stress, and all of that. But then he continued 1 month, 2 months, and then she had to involve her family. And then they discovered that he had taken enhancement drugs. And he had taken this enhancement drug for years, like for 2 years. So now the question I'm trying to get from the story is it possible that those things, taking of drugs, addictive drugs, enhancement, sex and penis enlargement drugs, sex enhancement drugs, smoking of addictive weeds, all these cigarettes, do they have any effect on the male body that can cause this dysfunction?
Okay, yeah, they do because like I said, part of the challenges we have with drugs today is that a lot of them have side effects. And some of these drugs that will, especially like, I think Viagra, I think that's Viagra. Yeah, the one that is quite common is initially it was produced as a drug for controlling hypertension. That was initial it was initially for hypertension until later on it was now, I think it was part of the process of either research or something. That was how it was now changed to a drug for for sex enhancement. But the original intent was actually for hypertension. That is why you cannot combine it with an hypertensive drug.
Okay.
Because it will keep on bringing blood pressure, and from there the person might go to where he came from. So that is the thing. So a lot of all these drugs actually cause it. Now, like I said, many people, when they have this erectile dysfunction, they don't go to the where the problem is coming, the source of the problem. Let me give you an example. 2 years ago, I met a guy. He's 27. He hasn't been long. He saw his, okay, let me even start from where the problem started. He said he was having erectile dysfunction. And I said, what happened? Because one of the days he just called me. It's like, what? He now told me that he saw his girlfriend, like they have not seen for some months. So he now saw her, and then he wanted to do the do, and he discovered that before he could say Jack Robinson, everything has just faded. And I said, what happened? First of all, this guy is a young guy. You know, many people think erectile dysfunction can happen to any age. Actually affects all ages. That's the funny thing. So a lot of people should know that. And when you understand this, you now know that it's not just a health and an old age issue. Now, that guy, I asked him a lot of questions, at least make sure that he said yes, that he was, before then he was sexually active, no problem. That he just that he's not been long so hard. So I was now able to deduce that he was having, it was more like an anxiety, you know, that kind of, you have not seen somebody you love for some months, and then you just saw her, and then you wanted to do all the things you didn't do all the months and all that. So guess what? Do you know what solved this problem? What? To shock you, what actually solved it? Chocolate. Yes, because I told him when I finished speaking with him, I discovered that his problem was more psychological. So I told him, don't even try it. Don't even try and get any of these things, drugs. Then I now told him that what he's supposed to do. Okay, sorry. What he's supposed to do is, I was able to eliminate health causes and now narrowed it down to psychology causes. It was now the anxiety. And not me should just calm down. Now prescribe some, physical therapy. Supposed to, I think we told him stop mechanism and all that, because he said he was having the erection, but then it was not prolonged. By the time it was almost like a 2-minute man kind of thing. So I now told him that I said, by the time you do this, go for chocolate, and it does not work. That anything drug is a last resort. That for crying out loud, they are too young for drugs. So we had to now, by the time we eliminated, I told him to go for chocolate. Now, one of the interesting things about chocolate is chocolate, yes, has been, mildly used as an aphrodisiac. Though I didn't really go much into how it works, but I know that one of the things it does is that it has this soft, very sweet, soft, tender feeling to it when you are taking, especially original chocolate. So when you're taking it like that, it actually stimulates, this feeling of pleasure, because, one of the things about the human sexual response is because of the hormones that are activated, the serotonin, the adrenaline, and all those things. So when all those things are stimulated, anything that can stimulate them can actually stir up sexual excitement. So now, in terms of that, chocolate plays a role. It may not work for everybody actually, but for him, that was what worked for him. You understand? So that's why it's not like I'm prescribing it, but I'm just telling you that was what worked for him. You understand? So that's just how. That's why when there's a way you take chocolate, there's this soft, you're having this, euphoric experience when you're taking chocolate, especially when you're taking it slowly. Yeah, it's just a very practical thing, and that was what worked. And next time I spoke with him, he was so happy. I said, I beg, continue. If you want to get impregnated, that is not my business. I've done what I'm supposed to do.
Yeah.
No, the funny thing that I knew that he was not ready to marry her then, but I told Oga, you know what to do. So I'm not going to talk to you much about this. So if you want guy impregnate her, I'll clap for you. So he was not laughing, but he got my message. So that's just the thing about management. Then there are some people that if they're having premature ejaculation, and premature ejaculation is different from erectile dysfunction, because a lot of things that are similar actually, but then you can't really see the only thing is just that with premature ejaculation, it could be that it's just the first maybe the first round that it happened. So for you to diagnose premature ejaculation, you have to look at actually where it's coming from before you can now call it erectile dysfunction. That's it. But then it can lead to erectile dysfunction. They are just kind of interconnected. But then erectile dysfunction is just that you cannot achieve. Like it's as if you are just going in and then you are is the person they call what they call it now. Okay. Now premature ejaculation, they are just similar, but they are not essentially the same. Let me put it that way, so a lot of our listeners will not get confused.
Yes. Okay, so basically the question was that taking of enhancement drugs, addictive drugs, has a way of causing this dysfunction.
Yes, because you are doing something artificially. You are doing it artificially. And remember, these drugs actually, many of these drugs, they actually attack the cells. When they attack those endothelial cells, it means that for you to, okay, no, let me even go to the hormonal aspect. For you to, it means that you'll be dependent on it. So now you're not giving the body the opportunity to stir up this process organically because it actually starts from the brain. It
Yeah.
actually starts from the brain. So then when you are not able to do this organically, just like somebody that is dependent on alcohol dependence or addiction, when you're addicted to something, it means that without that thing you cannot function. And that creates a problem for you. So as you keep on taking it for a very long time, and that's why all these sex enhancement drugs, they are not encouraged for you to take it for a long time. They're not encouraged to take it for a long time because they will cause damage to your endothelial cells. And when that happens, you will not be able to you have problems with enlarging the dilation of your muscles and all that. And remember, erectile dysfunction is connected to actually other health conditions. But that one, we can still talk about that one as
No, let's
we progress.
discuss it now.
Okay,
What are
let's
those
talk
health
about,
conditions? What
yeah,
are those health conditions?
that,
And then
yeah, for example,
are there drugs too that also pushes it?
okay, causes it. Yeah, yes, of course, there are. BP drugs, for example, that Viagra that I mentioned, sorry, not Viagra, sorry, hypertensive drugs actually can cause erectile dysfunction.
Okay.
Hypertensive, I'm sorry, anti-diabetic drugs can actually cause erectile dysfunction. And people that on anti-cholesterol drugs or drugs to help statins, drugs that help to reduce cholesterol actually can have erectile dysfunction. Then people that are taking psychoactive drugs can also cause erectile dysfunction.
Okay.
Alcoholics, yes, can also have erectile dysfunction.
Smokers, uncle.
Those ones are them member smokers, those people that are taking hard drugs. Yes, they are. Yes, exactly. Because I keep on asking them many times when I ask them, because all these things are related and interconnected. Many of the smokers, some of them, they end up having low sperm count, and the relationship between all these things and testosterone, that is a hormone that is responsible for production of spermatozoa and the male secondary sex characteristics. All of them, they are interconnected. So now, when you're talking about testosterone now, sorry, when you're talking about low sperm count and anything that will affect your low sperm count, it's likely to also affect your ability to have it's likely to cause erectile dysfunction. That's the thing.
Yeah.
So then then the conditions that can lead to it um, there's this thing they call peripheral arterial disease. It is estimated that those people that have, like, they know it, some of them know it as, they call it, the local name is achere. Yes, because what happens is that the blood supply to the lower part of the leg is blocked. So when it now blocks, then you're not able to have blood supply to that place, and then there is reduced oxygen, and then the place gets starved of oxygen, and then the person starts having problems there. The place starts getting darkened, and if you don't manage it properly, it can lead to a very extensive injury or ulcer on the leg ulcer. Yes. So many times there are some people there actually originates from there, and those people that have that, there's a very they have a high chance of having erectile dysfunction, especially for
Okay.
males that have it. For males that have it, yeah.
Wow. Wow, this is a lot. This is a lot. All right, so let's go back to the treatment now. What are the ways to treat erectile dysfunction?
Okay, so let's start from, first of all, you have to, when I talked about insulin resistance.
Yeah.
That insulin resistance has hypertension, diabetes, high cholesterol. They're all in that group. Now, the thing there is that why I mentioned them like this together, in as much as they are all different conditions, because it is as a result of metabolic dysfunction. Like metabolic dysfunction is like your body's ability to break down all the nutrients you need and then absorb them and use it for your day-to-day activities. Now, the increased insulin production actually causes you to have problems with these health conditions. And now, when it happens, you are not able to. The person comes down with conditions like hypertension, high cholesterol, diabetes. Because why I keep on mentioning this is that they are very common health issues today. In fact, it's a public health concern right there in the US. It's a billion-dollar industry. Only diabetes, there's a billion-dollar industry. Then before you go into hypertension, many of them are all interconnected. So many times, one of the things they should do is this treatment is they should lifestyle modification. Very important. Lifestyle modification. Number one, you have to have adequate sleep. Two, you have to stress management. Then, three, you also have to treat any underlying medical condition. You see, many people, the problem they have, I have a case, that was several years ago. It says just similar to the one you talked about, but this particular one, they were about getting married. So, and it's all these, churches that are very strict on all these, you understand? So, the lady, she just said she had this, leading to visit the guy. So when she now visited the guy, she now said, okay, you know what, Oga, we'll do this thing this night. She tried all she could do, every trick in the whole wide world, they could not get an erection. She tried all. Now she asked the guy was just dodging and going around in circles. Guess what happened the next day? The guy now confessed. I had a UTI when he was a teenager. He didn't manage it properly. So, and that led to him.
So that
yes, he had a UTI, yes.
What is UTI, please?
Urinary tract infection, sorry. He had a urinary tract infection, and then he did not manage it well that time. And the thing now led to him having erectile. So he knew. It's not like actually he didn't know as at that time. He knew. And the lady, actually, she said she was the type that was okay, yes, trying to stick to abstinence and all those things. But the problem was that day, she just had that nudge to go to visit him. And this one was just before they could do the, I think, introduction or, something like that. That was when this thing happened. So you could see why it's a problem. A lot of people today, they have those urinary tract infection. They did not treat it properly. And it will cause problem for them tomorrow, both male and female. And that's it. Some of them had sexually transmitted infection that they did not treat. And then they will just feel, okay, it's all right. And then later on, it will cause problem for them. So that is why on this matter, I will encourage our women to, you see, at the end of the day, it's women that will fight this thing. This particular one I'm talking about now. Yeah, this particular one I'm saying, they are the ones that have to fight it. Yes, I know why I'm saying it, because that's how I say it too, because I always tell women that many problems they have today is not because, they are women. It's because they enabled it. When you enable something, anything you see, you take it. So don't come and call a men and wicked men and that. Because some of those things that you're talking about, you saw it and you have been seeing it. So you cannot just wake up one and say, men, and that one, you enabled it. In this particular case, when it comes to the earlier part, there are some investigations you need to do. If the guy says he's not doing, you have to insist. You have to insist. Because if you don't insist, tomorrow, whenever that happens, they will just shove you aside like a waste bin. They will just, like the way they will shove you. In fact, they will move on faster than you even think, than the speed of light. So that is why you have to insist. Very important. There is no two way about it. We're not patronizing anybody. You have to insist on it. So now, one of the cases we have is when these women have these conditions now, when these men have this condition, they know. Now, when you ask certain questions, they will go around it. You understand? Yeah. Let me give you for example, why I insist that women should fight this. You know about the racist factor issue. And you know that I've had cases, in fact, but let me just tell you what happens in most of those cases. you see a lady now, maybe when she was in university, she was maybe let's say O positive, O negative, and she had maybe had took in during university, and she ended up maybe aborting the child. Part of a lot of things that happen in the university. Now she goes back maybe years later, she gets married, and then she's having problems with childbirth. The man is O positive, and because the man is O positive, obviously it will happen. So now, why since the man is O positive, this scenario will happen. The woman will try taking, and the child is not able to, so the pregnancy is not sustained. Now, they will be insisting that the woman expresses or like reveals this information, because by the time she tries taking in 1, 2, 3, 4 times, madam, what is going on? The man will insist, and she will reveal this information. Now, I had a case whereby the guy, in fact, why he did not marry the girl was because he got to know these things. He told me to give him a professional advice. I told him I didn't tell him not to marry the guy. I just told him, see, take this, this is the information. And I told him, okay, the decision is yours. He ended up not marrying that girl. It's not my fault because I gave him professional advice. Why I'm saying this is so that ladies, when it comes to their own, these are things you have to emphasize on. Because the church and the society or whatever have not emphasized so much on particular tests you need to do before you get pregnant. Yes, so they always focus on HIV, which is no more a public health issue now because the drugs are subsidized and it's very easy to manage. The HIV, hepatitis B, blood group, genotype, none of them actually checks sperm analysis, semen analysis, because when all these things come out, it's when we now begin to ask questions.
Yes.
You tell the man to go for the test. It tells you one story or the other. You understand?
Sure.
When it tells you one story or the other, you ask and then you keep quiet because you want to get married. You continue. Tomorrow it becomes a problem. You see? So the issue that they need to emphasize on these things. Now, another problem we have is that when you go down to the church or when in an environment whereby they say pray, we went for fruit of the womb. Why is it that it's only the women that come out? They lay hands on the women. The problem might actually be that uncle is not able to, doesn't have enough sperm to be able to impregnate the woman. Yeah. He needs 20 million, yet when you check the semen analysis, the guy might have just 5 million. And he cannot do anything. Yet you are there laying hands on the woman and releasing blessing and fire on the woman. She's the one that comes out. She's the one that runs around. Tomorrow, only for years you come out, only for you to discover that the problem was actually for the man. Yeah. So they have to do these things. It's not me that's going to fight it. I'll do the one I'll do in the office. Which some of them, when they come, I know how to handle it. But then this is where some of them have to insist. When they're coming for marriage like that, you have to insist on these things so that it don't takes you unawares. You understand? So that is just my take on that aspect.
This is really a lot because like you said, it's as if the society focuses more on the women. Like when it comes to marriage, it has to be women, and less focus is put on the man. So now I want to ask, are there tests that can be done in the hospital? Because let's be real, no church will advise their lady or any lady to go and test, like the other lady tried to do. No church will okay, try, let's see if there will be an erection or sustained, sexual intimacy. But are there any medical tests that can be done to further help this situation? Like you can go to the hospital, check, is this man potent? Does he have any erectile dysfunction or any sexual related problems? And then you come out with a test result. Is there anything like that?
Yeah, you can do a semen analysis. You understand? You can do a semen analysis. You use it to be able to give you a picture of one of the things in the semen analysis. It tells you about the quantity of the sperm, the quality of the sperm, and the any other issue that's going to, if there's an infection, it tells you. Because even professions actually expose men to some of these issues. For example, if somebody that is working in an environment that has so much chemicals, all this chemical industry and all that, it exposes the person to low sperm count. Now, the thing there is that testosterone, is not just a measure of, the person, whether the person is impotent or not, because some people can have it high, some people can have it low. And remember, these hormones, essentially what you have in men is what you have in women. So, but then when there are changes, you now begin to look at a lot of things. It could also be hormonal. Maybe the person had a tumor in the brain, in the pituitary part of the brain. And these things can lead to the person having, there's this condition they call, let me just call it high prolactin, like, the hormone that is supposed for milk production in women, but then it can also affect men. Now, some of those men get some of their characteristics when they have it. Some of them will have, increase in breast size, obesity, and then they now have erectile dysfunction. Yeah, but some of these signs actually looks like someone that is an alcoholic. Many people that take alcohol actually have that, increase in breast production. Yes, it's there. So you can mimic it, and think, I don't just man, they're just doing this, they're just doing that. Meanwhile, my what's wrong with him? So that is why you need to do, like, in addition to all those hepatitis B and all those ones that they do, they also have to look at fertility. You see, now when you look at, that's why they have to ask a lot of questions. Before, like now, it's something that anybody can start. When you're going there to hospital, you ask the doctor, go through some health, checks. Then part of the thing you can do a prostate scan. Because if your prostate, and that one it goes a long way. Because especially if you have maybe a peculiar issue. Now you can do that. You can do a urinary test, yes, to check for infections. Yes, urinary culture. You can check for infections. Very important. Urine analysis, very important, because it could be infection, it could be just, it depends on the level of your system, where it happens. Maybe if it's in the bladder, or in your kidney, or in your ureter, all those things. So all this is the essence of all those tests. It's not like, okay, everybody should just do and do it, but then there are peculiar issues. If you're somebody that is sexually active, for crying out loud, you have to take special care to check all those things. If you're not sexually active, then I'll understand. But these are things that a lot of people have to make decisions based on their own unique needs. That's the thing. So you won't say, okay, there's a particular test, but then there are tests you need to do, especially that semen analysis, urinary culture. You can do a scan, pelvic scan. In fact, for men, you can do a pelvic scan if you're concerned. Because when a woman is not able to, let me tell you one of the things that happens. When it comes to infertility, one of the primary things they ask is that is supposed to be, which I don't know whether some people do it. They will check whether the man has a low sperm count. That among the primary things. Remember, we live in a country whereby it might end up being actually the quadrenary thing they do. The primary thing they will do is tell the woman to go and do this one. Now they will subject the woman to a lot of scans. There's one they call hysterosalpingogram. They will check. They will go through to check whether there's a blockage in the. Why don't they do some of those things for the men too? Because while the woman is going through all these things, uncle might be having low sperm count. He might be impotent, and we're here doing tests from one Jerusalem to Jericho. You understand? So that is actually where this whole problem is. And I think we can do that if many of us that are listening should be able to take adequate precautions.
So literally, there is no test that can be done on the man to discover or to ascertain if he has ejaculation issues, erection issues. That's what my concern is, not really the infertility. Are there any tests to ascertain if this man has ejaculation issues, erection, especially that erection issues?
Okay. In terms of that one, there are some questions you can ask. The average man actually should have about, I think, 3 to 4 erections over the course of his sleep. A man that doesn't have any, yes. Now, the problem is that some don't have this, some don't experience this. Or then early morning, when you wake up early morning, the average man has an erection early in the morning. Why is this so? Because there is this 2 parts of the system. There is parasympathetic, sympathetic. What happens is that your body is more relaxed at that point in time. When it's more relaxed, it means that there is this content called nitrogen oxide that is released that makes it to be able to be open. You understand? So that is what happens to every man. So when you are not having these things I mentioned, it means there's a problem already. So the only test you can do in terms of this is that you have to now ensure that there is no underlying health condition. Then also the man is having this issue. I'm telling you, if an average man should have at least up to, I think at then 3-4 in the night, then throughout the day should be like around I think total in a day should be around 12 if I'm not mistaken. Like erections, just it may not. That's the average. You understand?
Okay.
Sometimes if it's less, then it's just a problem. So I've not seen any test whereby it is a specific on that. But there are things you have to look out for. These are the major things you have to look out for.
Okay, because the
Because
reason why I'm asking. Okay, go ahead, please.
No, I was just trying to, like the girl I told you about. She went there on her own. She was just let to go there. It's not like something she was supposed to do. You know, but some people might not be that sensitive to be able to make that move. She took a risk. She knew she took that risk, but if she didn't make that move, she wouldn't have found out. She would have ended up marrying somebody that will just keep on deceiving herself or himself, and then it will lead to even more serious problems. That's it.
Okay. Because the reason why I asked that question is that so many men actually know they have this problem.
Yes.
They know they have erectile problems. They know they have this dysfunction, but they don't talk. And then the woman follows them into the home and discovers the problem. I don't know if you understand. So it's not that they don't have this situation. Like, you know, the two cases I have recently, they knew. And then the woman went into the marriage and then discovered that this is a problem. So I'm sure if there was a way to kind of discover if a man is having erection issues, you know, before marriage, without having to let's try to have sex and all of that, if there is a medical procedure, probably it would have helped curtail situations like this, because it's a lot of emotional trauma to get married to somebody and then discover that there is a problem in this very important area. So that's why I was asking to know if there is particular procedure that can be made to get that done. All right, so you've talked about treatment, you've talked about causes, you've talked about preventive measures, you've talked about lifestyle. Let's talk about the emotional aspects. Let's talk about the hereditary aspect. Is it possible to actually inherit this?
Erectile dysfunction.
Yeah.
Inherit. Not necessarily. You know why I said it? Because when you might go online and you might see a lot of things, the same thing they tell us with hypertension and diabetes. Many of those things, why they are enforced is because the same lifestyle that your father did is what you're also living. Obviously, that thing that happened to him will be happening to you. So now, we discovered that many things about when it comes to genetics, genetics doesn't play so much role as we think it does. The only thing is just that there's what they call like there's what we call like see, I was avoiding medical terms, but then let me just say it the way it is. The thing there's a way these things manifest. It's more like a lock, a key, or like you use to open something. So now when you live a particular kind of lifestyle, it shows it reveals it. You understand?
Okay.
When you don't live a particular lifestyle, it kind of locks it in. The same thing about obesity. Obesity is not as genetic as we think it is. It's just that, in fact, from what I've learned, is 5%. It contributes just 5%. So you now ask yourself, how does it all manifest? So now, when it comes to anything genetic, one thing medical science will tell you, okay, yeah, that this one is genetic. But the truth about it is that when it comes to how the thing manifests, it still boils down to your lifestyle. You understand? Because the only thing that can be genetics, maybe let's say all these congenital health conditions like sickle cell or all those ones. Yes, I have not seen cases whereby erectile dysfunction is genetic. But the only thing, one thing I also know is that many of them that called for that actually is because they have not actually done what they're supposed to do. You understand? But I've not seen like a specific case whereby they say, okay, or even heard whereby this particular case is erectile dysfunction. Because if they had, what did you do where you were a child, teenager, young adult, then when you are ready to get married? You understand? They would have done something. If not, there are some ways to manage some of those things, like the pump and all that they use. But then I'm actually trying to encourage people so that they will be less dependent of anything that involves taking chemicals and all that. That's actually my own concern when it comes to this talk.
So basically, you don't need to inherit it. You just need to inherit the lifestyle. So a child grows up and sees the father smoking, drinking, and sees that as the normal way of life, and then begins to implement that same thing. So they put the possibility of picking up what the father had because of the lifestyle.
Yes. And the man, maybe the father had cancer of the lungs. The guy will now have cancer of the lung, and he now say it's genetic. Oh, the father had, then the guy had. You understand?
So I understand. So it's just simply do what your father do, you get what your father got.
Simple. Yeah, that's it. Simple.
All right. So to you who's listening, I don't know the lifestyle you saw your father living. You have to go back and check a track record. Is there anything he suffered? You have to now ask yourself, is it the same thing I want to suffer? Then it should, kind of advise you to reconsider your lifestyle. All right, sir. So let's really, before we go, sorry, thank you. We've spent 1 hour. Before we go, treatment. I really want us to, expatiate a little about the treatment. Apart from lifestyle, are there medications you can take, see the doctor? Because there's a lot of, of course, everybody wants to talk about traditional. We are not ignoring that. But are there medications that can be taken to curtail this?
Okay, yeah, there are. There is Viagra, there is sildenafil, there are Viagra, Cialis, there are a good number of them. Then there are also the natural one can go. So that's why I was actually avoiding the issue of drugs, because one has to be careful as a medical to make mention of these drugs online. Yes, so I was actually being careful. But then there are some natural things one can take to actually improve their sexual performance. Let me put it that way. Any drug that increases nitrogen oxide in the system is very good. And you can get this nitrogen oxide from lettuce, you can get it from cabbage, you can get it from, there's one thing they call ashwagandha. Yeah, it's a lot of all this natural stuff, ginkgo biloba, a lot of them, but there are some that are actually okay. Wait, just give me a second, let me check. There's something I wrote down. Something that I will not make a mistake. Okay, just give me a second.
Alright, so that's fine.
I wrote it down because it was something. Okay, I think I found it. Okay, yeah. So it's a natural L-arginine. Yes, it's a supplement. It's a supplement that they can take. So it's not there's no concern about side effects here. So that's why I can be comfortable to say it. Yeah, because if it's actually drugs, arginine and citrulline. These are two supplements that are very good. They also help to increase nitrogen oxide in the tubes, and it also can help with erectile dysfunction. Arginine and arginine and citrulline, they're very, very helpful. Yeah, for that. Then all the drugs that can, food that has nitrogen oxide mentioned, like lettuce, cabbage. Then there's a nitroglycerin that you talked about, that one, but that one is also chemical. So that's why you have to look at what the person's having for you to be able to prescribe those particular ones.
So very importantly, see a doctor. Just go see a doctor.
Exactly. So yeah, because they have to take note of unique individual peculiarities. You understand? For them to even to prescribe. That's why people, when you tell them about drugs, they should know that individuals differ. Because you might say, okay, maybe we're two people having the same malaria. They will give this person a different drug from your own. Maybe there are some questions they ask the person, or some peculiarities that made them to give two or three different drugs. You understand? That's it.
Okay, so very importantly, see your doctor. so that they're able to track the origin, ask questions. Don't try to do self-medication. Like that is another problem. Self-medication. And
Yeah.
my great grandfather used to take one drug.
Yeah, of course.
So those are all of that. Then finally, please, how can wives, mothers, sisters support or help men who have erectile dysfunction?
Okay. First of all, they have to be empathetic. Empathy is very important.
Yeah.
You know, is because it's just a lot of just maybe very few men that can really be very vulnerable and open about their health concerns. Many times, actually, the woman that will detect it, she will persist, even fight with him before he agrees to go to your hospital. But many times, you have to be empathic too, empathetic, because the problem he's having is not that he doesn't have the mouth to talk, it's just that he has been programmed not to talk about his
Yeah.
problems. So you have to be empathetic. Then you also have to find a way to give him that create that atmosphere for him to be able to talk. You make him trust you in talking, saying that kind of thing.
Yeah.
Because you know one thing about medical practice is that, let's say now you and your husband, you are going to see a particular doctor, and then your husband has a health condition. The license prevents him from telling you his health condition without his consent. So many of these
Yeah.
people, when you understand this, it now makes it, you make you understand why they may not say it. You might even go to the doctor also play along. You know, me, I do it too. I just play along. I say, until you are able to allow me tell this person, I'll tell the person. So I'll not go and be, confidentiality is actually very important here. So that's it. So you have to be empathetic. You have to also create the environment for them to be able to, let him trust you. Because some men also notice that when you give them when you make them trust you, they're able to tell you even some health conditions that you'll be surprised about that they're having it. Now, because many of these people, like this one, talking about self-medication, you discover that he's taking all these drugs. You ask him some questions, he's hiding it. He's hiding it. Yeah, I had an experience whereby this woman, she told me about her husband, and okay, she works with us in the unit, and she told me about her husband. Okay, no, she just came out one of those days where she were together in the same church environment. So she told me that the husband was becoming aggressive, and you know, he was now becoming, staying on his own. Like when you ask questions, he will just lash out on you. And that he
Yeah.
noticed that he's having poor erection. It was erectile dysfunction. And then I asked her what about the health condition. She said the man has, diabetes, diabetes, and I think he was already in his 60s too. So then I now asked her, so she was now asking what she would do. And I told her, she said that she has been trying to encourage him that she doesn't need to work for her, that sex is not more a problem for her. I said, Madam, you are not a man, you will not understand. For him, whether sex is important for him, as far as that he's not able to, he's having issue with erection, it's a big problem for him. His ego is finished. This man I'm talking about
Yes.
is a grandfather, his children are in university and married and all those things. But see, this man, yes, you might say that sex is not important for you, that you are not what you are just concerned about companionship. Madam, for him, as far as he's not able to have an erection, I'm not saying that he's playing around, but for the fact he's not able to have it, his ego is already
Yeah.
affected. So I'll now encourage that. Say, just try to, pet him, try to make him understand that nothing there. Let him just try to do some assessment, do some tests, and check whether what is really going on there. You see, that's kind of thing. So for her now, she feels she doesn't need to worry about sex, that she know. But this is the man that is, look at this problem. So empathy is important. You create that environment, and also try to discourage him from self-medication. Do all you can. That you will come and take one drug and make you, then people will do it for 30 minutes, 40 minutes, 1 hour. It's not the point. You are killing him by actually enabling that. Because he will go and take those drugs, it will satisfy you. Tomorrow you will have to take it to satisfy you. And his body becomes dependent on that drug. And then later on it
Yeah.
will cause more problems for him. So you're enabling it. You think you're enjoying yourself because you are high, you're honey. Remember, you also have to make him understand that, okay, let's go to the root of this problem. You also have to make him, don't encourage all those things, all those natural things. Because like I told you, it might be that the problem is emotional, yet he's dealing with it medically or pharmacologically. Yeah, it could be pharmacologically, and they're channeling all their energy in, fall and die, all my enemies fall and die, that kind of thing. So you know, to have to attack the problem at the source. Me, I like that. I meet people when they come with, my BP is 100 or 150 or 160 over 100. And I say, wait first, what kind of thing you do? I ask a lot of questions. Before I narrow down to drug, I must have ensured that I've dealt with all the triggering factors around before I now come down to drug. Because when you start drug, you don't start to. So you better just make sure that there are some cases that if it's not true, I just tell him, okay, my friend, go and make some changes in your diet. Come back next week, we check it again. You understand? That adjusts it. So they should do that. Then I think another thing they should also do is that they should also try to be discreet about their husband's health condition. That one is very important. That one can finish a marriage. Only that one. You have to be discreet about it. Discreet in the sense that your mother should not know it, even if she wants. Let her be your bestie. Your sister should not know it, even if you die your sister. And in fact, she will die for you. Maybe after Jesus, she'll come and die for you too. You have to, because these are things that comes from confidential is very important. If he knows that you can do all these things, it's very cool for him not to like open up and say, okay, yes, trust that my wife can do this for me. Even his brothers, because he might not even tell his own brothers too. So you are the one that is in a position by covenant or by agreement, by everything, for him to be able to, because you are one now. You are one with him, so you should be able to give him that opportunity, give him that room for him to be able to express this. Don't carry it over your head. And then when it comes some of them that are not able to that are doing that TTC, also while you are doing it, ensure that while you're making them, either he's going with you or that he's there. So that as you are asking questions, doing your own test and examination, there's also do his own. So it will save you all those years of running around from pillar to post, from native doctor to medical doctor, from pastor to punisher, and then at the end of the day, the problem is actually under your nose. This, I will not come and do it for you. It's you that is the woman that will do it for yourself. You might be surprised, even your family cannot do it. So it's you. So you have to find a way to be able to achieve this. So you don't go and waste time. So not tomorrow you come back to church, they'll be laying hands on you, yet your husband is the one that is not, the seed is not there. You're talking about the soil. That's the thing. So with this, they can do a lot with that. They can also encourage them. Also food too. They need to, you see, this thing about food, you need to encourage them. You don't need to, you're not trying to impress anybody by being on a high carb diet. A keto diet is fine. Intermittent fasting is fine. Protein diet, carnivorous diet is fine. These are things that will help, that can help to stimulate that can help to correct a lot of all this metabolic dysfunction, which can actually predispose you to erectile dysfunction. If you can do this intermittent fasting, carnivorous diet, keto diet, these are things that will help you a lot. You should stop alcohol. I'm not even saying limit. Sorry?
Carnivorous diet. What is that,
yes,
please?
It's more like a meat-based diet.
Okay, like staying away from meat.
No, meat-based diet, a meat-based diet that is focused on meat. Emphasis on meat. Just like when you have keto diet, so it's a carnivorous diet.
Okay.
Right. So that's it. So with this, stop alcohol. It's not even about start doing small. Stop entirely. That's just like, what are you getting from it? Then also smoking, all those things, because you are not just looking at the outcome. You are looking at the source of the problem. So you are doing everything that you have to ensure. Because me, whenever those kind of women come, I always ask them about the lifestyle of the husband. Some of them, they will tell me, he will just say in Igbo, you don't say, they will say it because and the way they will say, they will say it in as if maybe one monster will come and beat them. Well, me, I'm just the only one with them in the office, so that they will just say as if somebody will come and beat them. Say, or me, when they keep on, they are finding difficult to answer, and I say, does he take this thing? I'll just do something. Say, yes, he does it. He does this one too. He say, yes, he does it. I want to trust in that. Yes, that's it. I think with this, it's enough for them to take care of ensure they deal with it.
All right, somebody just asked, he said, does masturbation in any way contribute to causing erectile dysfunction?
Yes and no. Let me put it that way. Yes and no. Because one of the challenges with masturbation is the what they call it now, the addiction. One, then two is the way they do it. You understand? And because sometimes when you do it, you are desensitizing the shaft, and it will now predispose you to erectile dysfunction. So, but on its own, it will not. Now, when you now also go at the hormonal level, because it is not the real thing, then by the time you now sends back information back to your brain interprets it as the real thing. Now, when you now go for the real thing, it will not give you the same satisfaction you are having. So that is actually the relationship. So it's just like someone that watches porn. That's similar. The feedback is getting at the brain is like, okay, yeah, this it is. Now the person, just like even that, let me even use this opportunity. Porn can predispose one to erectile dysfunction because it's actually seeing the porn as the real thing. While is you know, so is more like when something is not real, that the fake. So he's seeing it, he's misinterpreting it. So when you now go for the real thing, you are not able to get adequate erection because the idea, like I said before, is that you have to initiate, the ability to initiate, maintain or sustain, and then sustain the erection for you to be able to have an optimal sexual experience. So if there's a problem with any of this, the person is already having erectile dysfunction because initiating will come from hormone from the brain, and when it comes from that, and when you now start, then you maintain it, the hormones already released, and then in the typical human male sexual response cycle for males, because it's also similar for females, but for males, you discover that you have 4 stages. You have the excitement stage, the plateau stage, the orgasm stage, and the resolution phase. So then from that resolution phase to the next stimulation is the refractory period. Then when you look at this thing, you discover that in the excitement stage, some people can have the plateau stage without having to go through the excitement stage. That's actually how this thing happens. Now, in the initiation stage, that's something that stimulates in me. You can just bypass the cycle. But the most important thing, this is just the 4 basic cycles. So it's not a rule that you must go through all these 4 cycles. So people who just go straight in and all that. So that's it. So some people have orgasm without ejaculation and all those things, but it's a different topic on its own. So, but just know that masturbation is yes and no, can cause, another way may not cause. It actually can also help the person in terms of the sexual performance. But everything has to do with how you balance what you are doing and what you are not doing. Now I'm talking medically. Now when you now go to the spiritual aspect, then it's a different, grammar.
True, that's true. Masturbation, pornography, intake of alcohol, what's it called? Intake of drugs, addictive drugs, cigarettes, Indian hemp, all of those things can lead to erectile dysfunction. Wow, I don't even know how to start thanking you already because it's a lot of information.
Yeah.
Thank you so much. I wish we had lots of time because it's like there's so much. We've not even talked about the emotional aspect. We've not talked about the sociological aspect. We've not even gone to the spiritual aspect. It's a lot, but thank you so much for bridging in the medical gap to enlighten us, expose us. I know there is going to be lots of questions. There is supposed to be time to ask questions, but our time is fast spent and we don't want to hold you anymore. So thank you so much. God bless you. If there is any need for us to have a part 2 of this, we will definitely communicate with you. But thank you so much for your time. I don't take it for granted. And I'm sure so many people are going to be learning a lot from this. I'm sure lives are going to be impacted. And much more importantly, I'm sure marriages are going to be improved. So thank you. God bless you. And I pray that you have more testimonies, you have more blessings. For this time you have spent with us, God is going to replenish it in Jesus' name. God bless you, sir.
Thank you. God bless you too. Yeah. Thank you.
Right. God bless you. Bye.
Yeah, bye.
All right. So I think you've listened to everything you're supposed to listen to, and It's now there for you to go back, because basically the ball is in your court. That's simple as it is. The ball is in your court. Any decision you make, I used to say, everything you do in life has a repercussion. Let me talk to men. And we need to let go of all this pride and ego of a woman cannot talk to me, a woman cannot correct me. I know I made a post sometime and men were lashing me. Like, a woman, you don't have the right to correct a man. You shouldn't use the word correct. But so many men are actually paying for the things that they are doing, their lifestyle, the things they do consciously and unconsciously. And so as a man, you may not feel that what you are doing has repercussions right now. But like every seed you sow, the harvest doesn't come immediately. You know that, right? It will go through the process of growing. So you are smoking and you think it's nothing, but something is happening to your body. You are taking enhancement drug, you think nothing is happening. Something is actually happening to your body. You are stressing yourself, you're hustling, you want to make so much money, you want to take care of your family, you want to take care of this, at the detriment of your health. You are unknowingly doing something bad to your body. So you need to be able to create a balance for yourself as a man. Because if anything happens to you tomorrow, you see all those people you're trying to impress, their life will continue. Yeah. So you finish working hard and then you carry the money and go down beer. You are taking the beer, it's enjoyment. Waiter, bring me 3 cartons, bring me 3 bottles. You are using your hand and your money to cause problems for yourself. So in as much as possible, you are a man, I respect that. But I need you to sit down and redraft the course of your life. I need to sit down and begin to take intentional steps, because the outcome of your life is not going to affect you alone. It's going to affect the woman you marry. It's going to affect your children. That lifestyle you're living now, you think it's okay. Your children are watching. Look at what doctor said. That it may not be hereditary, but inherited lifestyle. So you're doing it, your son is watching. And your son, you are a role model. So anything you do, he's noticing it. It's stored there in his archives. And when he grows, he will do it. So as much as possible, you need to sit down and recoordinate your life. You need to see that everything that doctor have said, if you need to replay this, replay it and then take notes, put it to work. Then very importantly, there is no glory in keeping silent. There is no glory in having problems and not talking about it. You have a health condition, please go out and look for help. Go out and ask for help. You know that your body is doing you somehow, go to the hospital. Don't wait until you break down before you now realize that, oh. Stop doing that to yourself. I mean, my husband will always say, you have just one life, one chance life. Live the life at its best. Give your life all you have, the best. You have problems, go to the hospital. Stop managing sickness. Stop managing infections. Your body is doing you somehow. You are not a medical doctor. Stop giving yourself treatment you don't even know what the problem is. Go to the hospital. I mean, they'll charge a fee, but then when you are healthy, when you are alive, it's worth it more than any other thing. So today I'm talking to the men because this is a problem for you. And very importantly, open up. Because I don't know why a man will have erectile dysfunction or any sexual related problems and will keep quiet. And then you marry somebody. You now marry somebody. What do you think? They will not know? They will know. So don't enter marriage in deceit. It's better she knows now and then decides to go through the journey with you than going to discover inside the marriage and then it becomes a problem. So you're having any health condition, open up to the woman you want to spend the rest of your life. This is the issue right now. And then together seek help. Stop hiding things. All this one I'm talking now, Madam, I beg, when you finish to talk, mind your business. I will not finish to talk. Oh. You have heard a lot. Doctor have said a lot. Go back and implement. The reason why this is free is so that you will not have any excuse why you ignored the knowledge. Ignorance is not the absence of knowledge. Ignorance, the knowledge is there, but you chose not to go for it. That's why it's called ignore. You ignored it. So knowledge has been made available. Go ahead, put it to work. You're having any health issues, go see the doctor. You need to open up to the lady you're preparing to get married to your wife. Go ahead. And you're dealing with any lifestyle, any addiction, please go for help. Stop it. Go for help. Ask God to help you. And I know that as you intentionally help yourself, God will help you. All right. Thank you so much for your time, for everyone that started this journey with us tonight. And please go ahead, share this. I'm sure someone will need it. Go ahead, listen to it again. Take what you need to take from it and then implement. Implement. Don't just get the knowledge and store it there. Put it to work. Put it to work. Because it's only when you put it to work you will get results. I leave you with that word. You are an intentional human being. Live intentionally. Take intentional steps. Take intentional choices. Because at the end of the day, you will reap every seed you are sowing. Yes. Nobody will reap it for you. You. So what kind of seed do you want to reap? Sow it now. All right. My name is Jane Odo, the Intentional Marriage Coach. And yes, of course, my desire is to see you enjoy your marriage to the fullest. God bless you. Have a restful night. Bye.